Ministry of Health of Ukraine. Krok 2. Medicine. Year 2019, number 185. A 3-year-old child presents with dyspnea that abates in the sitting position, occasional loss of consciousness and seizures, delayed physical development, cyanosis, drumstick fingers. Echocardioscopy detects aortic dextroposition, ventricular septal defect, pulmonary artery stenosis, and right ventricular hypertrophy. What is the most likely diagnosis? A. Transposition of the great vessels. B. Acquired valvular disease. C. Ventricular septal defect. D. Coarctation of the aorta. E. Tetrad of Fallot. Tetralogy of Fallot is a combination of 4 congenital heart defects. They usually result in a lack of oxygen-rich blood reaching the body, in which cyanosis and drumstick fingers are the symptoms. Ventricular septal defect, pulmonary stenosis, misplaced aorta, right ventricular hypertrophy, thickened right ventricular wall. Dextroposition of the aorta occurs when the aorta overrides the interventricular septum to the right ventricular side. Overriding aorta is a congenital heart defect where the aorta is positioned directly over a ventricular septal defect, instead of over the left ventricle. The result is that the aorta receives some blood from the right ventricle, causing mixing of oxygenated and deoxygenated blood, and thereby reducing the amount of oxygen delivered to the tissues. The answer is E. Tetrad of Fallot.